In 1924, Mr. Duke established the indenture, and at that time he selected hospitals, or not-for-profit hospitals, to be grantees of the indenture. During that time, health care was in great need. There were very few hospitals that had been established, and one of the things that Mr. Duke wanted was to have access to accessible and convenient hospitals for everyone in the Carolinas. So between 1924 and frankly up until the late 90s, a lot of the grant funds through healthcare were devoted to capital improvements and expanding hospitals and actually building hospitals in the Carolinas. Today, when you look at healthcare, it's very different than the 1920s. Today, what we see is a dynamic field with growing and expanding technologies. We see information systems that are enhancing communications. We see a system of care. Unlike a hospital, what we now have are facilities that are systems. You go from long-term care to acute care to emergency room care. So healthcare today is very different than what it was. However, we still have some of the same problems and some of the same issues that we had in 1924. One of which, and the most important I think, is the fact that we still have a growing number of uninsured who do not have funds to seek healthcare services. And Mr. Duke made it very clear, and to this day we try to hold on to this core value, that trying to ensure that the individuals who do not have funds to pay for care receive care. And he wanted to make certain that they had access to hospitals and to all healthcare facilities. One of our major challenges is to hold on to those core values of Mr. Duke today and try to adapt those to our environment. We do this by looking at strategies, and our trustees have identified three major areas of funding. Those three areas are: the first is quality of care. And when we look at quality of care, we have to address training, workforce issues, and we also have to look at evidence-based practice. The second one is access to care, which covers, again, the uninsured and other vulnerable populations that we care about, making sure that they receive the services they need. The third, which is a new area of focus for us, is prevention. And we know if we want to try to prevent chronic disease, then we need to look at funding programs that will prevent that. The other thing that we find important today is to work collaboratively in our environment. We know that partnerships bring forth shared knowledge. We know that working with numerous partners brings not only knowledge but also resources. So we put a premium on partnerships and on innovation. So when we make grants today, we continue to be inspired by Mr. Duke's original vision, and we hope that if he came back today and looked at what we were doing, he too would be proud of the grants that we're making and the technologies that have advanced and what's going on in the world today of healthcare.